Home Health Aide Test Chapter 1. Question 1. HHA help care for clients with chronic illnesses, which means that Option A. The illness lasts a long time. Option B. The illness is short-lived. Option C. The illness is contagious. Option D. The illness is easily cured. The correct answer is Option A. The illness lasts a long time. Chronic illnesses are long-term conditions that require ongoing management. Question 2. The payment system for home care is called the Option A. Home Health Prospective Payment System, HHPPS. Option B. Home Health Private Payment Service. Option C. Hospital Health Payment Program. Option D. Home Healthcare Preferred Provider System. The correct answer is Option A. Home Health Prospective Payment System, HHPPS. HHPPS is the standard reimbursement method for home healthcare services. Question 3. Which of the following best describes a difference between working in the home as an HHA and working as a nursing assistant in a long-term care facility? Option A. An HHA has more independence. Option B. An HHA has less responsibility. Option C. A nursing assistant has no supervisor. Option D. There is no difference in the roles. The correct answer is Option A. An HHA has more independence. Home health aides often work alone in a client's home, requiring more independent judgment than in a facility. Question 4. Which member of the care team diagnoses disease and prescribes treatment? Option A. Doctor. Option B. Home health aide. Option C. Social worker. Option D. Case manager. The correct answer is Option A. Doctor. Doctors are responsible for diagnosing medical conditions and ordering specific treatments. Question 5. Which of the following statements is true of the client being a part of the care team? Option A. The care team revolves around the client and his or her condition. Option B. The client has no say in the care plan. Option C. The client is only involved during emergencies. Option D. The care team only follows the doctor's orders without client input. The correct answer is Option A. The care team revolves around the client and his or her condition. The client is the central focus of the care team, and their needs and preferences drive the care plan. Question 6. What are the HHA's responsibilities if an activity is not listed in the care plan? Option A. The HHA should not perform the activity. Option B. The HHA should perform the activity if the client asks. Option C. The HHA should guess how to do it. Option D. The HHA should ask a family member. The correct answer is Option A. The HHA should not perform the activity. HHAs must only perform tasks that are explicitly authorized in the written care plan. Question 7. Why is reporting a client's changes and problems to the supervisor an important role of the HHA? Option A. The care plan must be updated as the client's condition changes. Option B. The HHA wants to get the client in trouble. Option C. The supervisor needs to know if the HHA is working. Option D. To reduce the client's insurance costs. The correct answer is Option A. The care plan must be updated as the client's condition changes. Timely reporting ensures the care plan remains accurate and effective for the client's current needs. Question 8. A professional relationship between an HHA and a client includes Option A. Keeping client information confidential. Option B. Sharing personal problems with the client. Option C. Giving the client a hug every day. Option D. Borrowing money from the client. The correct answer is Option A. Keeping client information confidential. Professionalism requires maintaining boundaries and protecting the client's privacy. Question 9. If a client has purchased a special gift for an HHA, how should the HHA respond? Option A. Refuse the gift but thank the client for thinking of her. Option B. Accept the gift and keep it secret. Option C. Accept the gift and tell the supervisor. Option D. Ask for money instead of the gift. The correct answer is Option A. Refuse the gift but thank the client for thinking of her. Most agency policies prohibit employees from accepting gifts to maintain professional boundaries. Question 10. What is required of an HHA if she suspects that a client is being abused? Option A. The HHA should report it to his supervisor immediately. Option B. The HHA should wait to see if it happens again. Option C. The HHA should confront the abuser. Option D. The HHA should ignore it if the client doesn't complain. The correct answer is Option A. The HHA should report it to his supervisor immediately. HHAs are mandated reporters and must immediately notify their supervisor of any suspected abuse. Question 11. What is one way that an HHA can help protect her client's rights? Option A. Knock and ask permission before entering a client's room. Option B. Open the client's mail to help them. Option C. Decide which clothes the client should wear. Option D. Tell the client's neighbors about their health. The correct answer is Option A. Knock and ask permission before entering a client's room. Respecting a client's privacy and autonomy is a key part of protecting their rights. Question 12. For HHAs, confidentiality means: Option A, keeping client information private. Option B, sharing information with the client's friends. Option C, posting client photos on social media. Option D, talking about the client at lunch. The correct answer is option A, keeping client information private. Confidentiality is the legal and ethical duty to keep all health and personal information private. Question 13. With whom can an HHA share a client's protected health information? Option A, with other members of the care team. Option B, with the HHA's family. Option C, with the client's neighbors. Option D, with anyone who asks. The correct answer is option A, with other members of the care team. FI should only be shared with those directly involved in the client's care. Question 14. What is one function of the chain of command? Option A, it helps protect home health aides and their employers from liability. Option B, it determines who gets the best shifts. Option C, it allows the HHA to bypass the supervisor. Option D, it is only used for payroll. The correct answer is option A, it helps protect home health aides and their employers from liability. Following the chain of command ensures proper oversight and legal protection for staff. Question 15. A blank is a method or way of doing something. Option A, procedure. Option B, policy. Option C, law. Option D, regulation. The correct answer is option A, procedure. A procedure is a specific, step-by-step method for performing a task. Question 16. One reason that the Health Insurance Portability and Accountability Act, HIPAA, was created was to: Option A, protect privacy of health information. Option B, provide free healthcare to all. Option C, increase the cost of medical care. Option D, reduce the number of doctors. The correct answer is option A, protect privacy of health information. HIPAA established national standards to protect sensitive patient health information. Question 17. Blank have to do with the knowledge of right and wrong. Option A, ethics. Option B, policies. Option C, procedures. Option D, directives. The correct answer is option A, ethics. Ethics provide a framework for determining what is morally right or wrong in professional conduct. Question 18. An example of ethical behavior by an HHA is: Option A, protecting a client's privacy. Option B, arriving late to visits. Option C, accepting tips from the client. Option D, discussing the client with friends. The correct answer is option A, protecting a client's privacy. Respecting privacy is a fundamental ethical responsibility in healthcare. Question 19. Which of the following is a legal document that designates what kind of care a person wants if he is unable to make that decision himself? Option A, advance directive. Option B, living trust. Option C, birth certificate. Option D, marriage license. The correct answer is option A, advance directive. An advance directive allows individuals to specify their healthcare preferences in advance. Question 20. What happens after a doctor refers a patient to home health care and an agency has been chosen? Option A, a staff member performs an assessment of the client's needs. Option B, the HHA starts working immediately without a plan. Option C, the client is sent back to the hospital. Option D, the doctor visits the client's home daily. The correct answer is option A, a staff member performs an assessment of the client's needs. An initial assessment is required to develop an appropriate and personalized care plan. Question 21. Which of the following is an example of a barrier to communication? Option A, HHA used medical terminology with the client. Option B, HHA listened actively to the client. Option C, HHA made eye contact. Option D, HHA spoke clearly and slowly. The correct answer is option A, HHA used medical terminology with the client. Using jargon or complex medical terms can prevent a client from understanding important information. Question 22. Which of the following statements is true of documentation? Option A, HHA should document care immediately after the visit. Option B, documentation should be done once a week. Option C, it is okay to record care before it is given. Option D, documentation is not necessary for small tasks. The correct answer is option A, HHAs should document care immediately after the visit. Immediate documentation ensures accuracy and provides a clear record of the care provided. Question 23. Which of the following occurrences is considered an incident and requires a report? Option A, the client falls but says he is fine afterwards. Option B, the client eats all of their lunch. Option C, the client takes a nap. Option D, the HHA arrives on time. The correct answer is option A, the client falls but says he is fine afterwards. Any event that is out of the ordinary or involves a potential injury must be documented in an incident report. Question 24. When using a transfer belt, the HHA should: Option A, place it over the client's clothing. Option B, place it directly on the client's skin. Option C, tie it loosely around the client's chest. Option D, avoid using the buckle. The correct answer is option A, place it over the client's clothing. Placing the belt over clothing prevents skin irritation and shearing. Question 25. A client who is lying on either her left or her right side is in the blank position. Option A, lateral. Option B, prone. Option C, Fowler's. Option D, supine. The correct answer is option A, lateral. The lateral position involves the client lying on their side. Question 26. A client who has her head and shoulders elevated and is in a semi-sitting position, 45 to 60 degrees, is in the blank position. Option A, Fowler's. Option B, prone. Option C, Sims. Option D, supine. The correct answer is option A, Fowler's. Fowler's position is a semi-sitting position often used for eating or breathing ease. Question 27. A client who is lying on her stomach with her arms at her sides is in the blank position. Option A, prone. Option B, lateral. Option C, Fowler's. Option D, supine. The correct answer is option A, prone. The prone position involves lying flat on the stomach. Question 28. A client who is lying on her left side with her upper knee flexed and raised toward the chest is in the blank position. Option A, Sims. Option B, lateral. Option C, Fowler's. Option D, prone. The correct answer is option A, Sims. Sims position is a specific side-lying position often used for rectal procedures. Question 29. A client who is lying flat on his back with his head and shoulders supported by a pillow is in the blank position. Option A, supine. Option B, prone. Option C, lateral. Option D, Fowler's. The correct answer is option A, supine. The supine position involves lying flat on the back. Question 30. If a client starts to fall, the best thing an HHA can do is to: Option A, widen her stance and bring the client's body close to her. Option B, try to stop the fall completely. Option C, catch the client under the arms. Option D, run and get help immediately. The correct answer is option A, widen her stance and bring the client's body close to her. Controlled lowering prevents injury to both the client and the aide. Question 31. How does the skin appear when it first begins to break down? Option A, skin turns pale, white, red, or purple. Option B, skin becomes dry and flaky. Option C, skin looks tanned. Option D, skin develops a thick crust. The correct answer is option A, skin turns pale, white, red, or purple. Discoloration is the first sign of pressure-related skin damage. Question 32. Which of the following is a condition that increases the risk of pressure ulcers? Option A, immobility. Option B, flexibility. Option C, good nutrition. Option D, frequent repositioning. The correct answer is option A, immobility. Lack of movement puts constant pressure on bony prominences, leading to ulcers. Question 33. A blank keeps the covers from resting on a client's legs and feet. Option A, bed cradle. Option B, trochanter roll. Option C, draw sheet. Option D, footboard. The correct answer is option A, bed cradle. A bed cradle, often confused with other tools, is designed to keep heavy linens off sensitive extremities. Question 34. During which of the following procedures must a home health aide always wear gloves? Option A, shaving a client. Option B, combing hair. Option C, feeding a client. Option D, answering the phone. The correct answer is option A, shaving a client. Shaving carries a risk of contact with blood, requiring standard precautions. Question 35. Which of the following is an appropriate way for an HHA to refer to a client's weaker side when assisting with dressing? Option A, involved side. Option B, bad side. Option C, limp side. Option D, broken side. The correct answer is option A, involved side. Using professional terms like involved side maintains the client's dignity. Question 36. A blank is used for clients who cannot assist to raise their hips into a bedpan. Option A, fracture pan. Option B, standard bedpan. Option C, urinal. Option D, commode. The correct answer is option A, fracture pan. Fracture pans are flatter and designed for clients with limited mobility. Question 37. A home health aide should reposition immobile clients at least every: Option A, 2 hours. Option B, 4 hours. Option C, once a day. Option D, 8 hours. The correct answer is option A, 2 hours. Frequent repositioning is essential to prevent pressure ulcers. Question 38. How often should clients in wheelchairs be repositioned? Option A, at least every hour. Option B, every 2 hours. Option C, every 4 hours. Option D, once a day. The correct answer is option A, at least every hour. Wheelchair users need more frequent repositioning because pressure is concentrated on a smaller area. Question 39. Which of the following should be washed every day? Option A, perineum. Option B, hair. Option C, back. Option D, knees. The correct answer is option A, perineum. The perineal area requires daily hygiene to prevent infection and odor. Question 40. When bathing a client, a home health aide should: Option A, make sure the room is warm enough before beginning. Option B, use very hot water. Option C, leave the client alone to ensure privacy. Option D, rub the skin vigorously to dry it. The correct answer is option A, make sure the room is warm enough before beginning. Maintaining a warm environment prevents the client from becoming chilled. Question 41. A home health aide should give nail care. Option A, when she notices that the nails are dirty. Option B, once a month. Option C, only if the doctor orders it. Option D, every morning. The correct answer is option A, when she notices that the nails are dirty. Nail care is part of routine hygiene and should be addressed as needed. Question 42. Which of the following statements is true regarding hair care? Option A, hair should be handled gently because it can be pulled out easily. Option B, hair should be brushed once a week. Option C, only the HHA should decide the hairstyle. Option D, pediculosis is not a concern for HHAs. The correct answer is option A, hair should be handled gently because it can be pulled out easily. Gentle handling prevents discomfort and hair loss for elderly or ill clients. Question 43. Oral care should be done at least blank time, a day. Option A, 2. Option B, 1. Option C, 3. Option D, 4. The correct answer is option A, 2. Standard care involves brushing teeth at least twice daily. Question 44. Which of the following statements is true of dentures? Option A, clean dentures should be stored in a labeled denture cup. Option B, dentures should be washed in hot water. Option C, dentures are cheap to replace. Option D, HHA should not help with dentures. The correct answer is option A, clean dentures should be stored in a labeled denture cup. Proper storage prevents damage and loss of expensive dental appliances. Question 45. Ways to prevent aspiration during oral care of unconscious clients include: Option A, using as little liquid as possible. Option B, turning the client on their back. Option C, using a large amount of mouthwash. Option D, feeding the client during oral care. The correct answer is option A, using as little liquid as possible. Minimizing fluid prevents liquid from entering the lungs. Question 46. When cleaning the perineal area, the HHA should: Option A, work from front to back. Option B, work from back to front. Option C, use the same part of the washcloth for everything. Option D, avoid using soap. The correct answer is option A, work from front to back. Wiping front to back prevents the spread of bacteria from the anal area to the urethra. Question 47. Which of the following is the normal temperature range for the oral method? Option A, 97.6 to 99.6. Option B, 95.0 to 97.0. Option C, 100.0 to 102.0. Option D, 98.6 to 100.6. The correct answer is option A, 97.6 to 99.6. 98.6 degrees Fahrenheit is the average, with a normal range around it. Question 48. Which temperature site is considered to be the most accurate? Option A, rectal. Option B, oral. Option C, axillary. Option D, tympanic. The correct answer is option A, rectal. The rectal site provides the most reliable measurement of core body temperature. Question 49. Which of the following thermometers is used to take a temperature from the ear? Option A, tympanic thermometer. Option B, oral thermometer. Option C, rectal thermometer. Option D, axillary thermometer. The correct answer is option A, tympanic thermometer. Tympanic thermometers measure the heat radiation from the eardrum. Question 50. The most common site that is used for measuring the pulse rate is the: Option A, radial pulse. Option B, brachial pulse. Option C, carotid pulse. Option D, apical pulse. The correct answer is option A, radial pulse. The radial pulse at the wrist is the most accessible site for routine checks. Question 51. The normal respiration rate for an adult ranges from: Option A, 12 to 20 breaths per minute. Option B, 5 to 10 breaths per minute. Option C, 25 to 30 breaths per minute. Option D, 30 to 40 breaths per minute. The correct answer is option A, 12 to 20 breaths per minute. Healthy adults typically breathe 12 to 20 times per minute at rest. Question 52. Which of the following is an example of the correct way to write a blood pressure reading? Option A, 120/75. Option B, 120 to 75. Option C, 120 plus 75. Option D, 120 over 75 mmHg. The correct answer is option A, 120/75. Blood pressure is recorded as systolic over diastolic pressure. Question 53. Hypertension is: option A, high blood pressure. Option B, low blood pressure. Option C, normal blood pressure. Option D, rapid heart rate. The correct answer is option A, high blood pressure. Hypertension is the medical term for chronically elevated blood pressure. Question 54. Which of the following measures can help reduce pain? Option A, changing position. Option B, increasing noise in the room. Option C, keeping the lights very bright. Option D, encouraging the client to ignore it. The correct answer is option A, changing position. Physical comfort measures like repositioning can significantly alleviate pain. Question 55. Guidelines for proper catheter care by a home health aide include: option A, making sure the drainage bag hangs lower than the bladder. Option B, keeping the bag on the floor. Option C, disconnecting the catheter to clean it. Option D, hanging the bag on the wheelchair handle. The correct answer is option A, making sure the drainage bag hangs lower than the bladder. Gravity helps drainage and prevents urine from flowing back into the bladder, which could cause infection. Question 56. 8 ounces is equal to blank milliliters. Option A, 240. Option B, 100. Option C, 500. Option D, 30. The correct answer is option A, 240. 1 ounce is approximately 30 milliliters, 8*30 equals 240. Question 57. To convert ounces to milliliters, the HHA should multiply by: option A, 30, option B, 10, option C, 100, option D, 5. The correct answer is option A, 30. The standard conversion factor for fluid measurement in healthcare is 30 milliliters per ounce. Question 58. Which of the following is true of non-sterile dressings? Option A, they are applied to dry wounds. Option B, they are used for open heart surgery. Option C, they must be applied by a doctor only. Option D, they are never used in home care. The correct answer is option A, they are applied to dry wounds. Non-sterile dressings are appropriate for closed or dry wounds that don't require surgical asepsis. Question 59. How can cold applications benefit a person? Option A, cold prevents swelling and reduces pain. Option B, cold increases blood flow. Option C, cold helps a person sleep. Option D, cold makes the skin warmer. The correct answer is option A, cold prevents swelling and reduces pain. Cold therapy causes vasoconstriction, which helps control inflammation and pain. Question 60. A sitz bath is used to: option A, clean perineal wounds. Option B, wash the client's hair. Option C, soak the client's feet. Option D, treat a headache. The correct answer is option A, clean perineal wounds. A sitz bath provides warm water immersion for the pelvic and perineal area. Question 61. Which of the following is an over-the-counter drug? Option A, acetaminophen, such as Tylenol. Option B, morphine. Option C, amoxicillin. Option D, insulin. The correct answer is option A, acetaminophen, such as Tylenol. OTC drugs can be purchased without a prescription. Question 62. What should a home health aide do if a client seems to have a negative reaction to a medication? Option A, report the reaction immediately to a supervisor. Option B, wait until the next day to see if it stops. Option C, tell the client to stop taking it. Option D, give the client a different medication. The correct answer is option A, report the reaction immediately to a supervisor. Any adverse reaction must be reported to the supervising nurse immediately. Question 63. Why does working with oxygen require special safety precautions? Option A, oxygen is a dangerous fire hazard. Option B, oxygen is poisonous. Option C, oxygen makes the client sleepy. Option D, oxygen is very expensive. The correct answer is option A, oxygen is a dangerous fire hazard. Oxygen supports combustion, meaning things burn much more quickly and intensely in its presence. Question 64. Which of the following statements is true of IV therapy? Option A, home health aides will observe the foresight for problems. Option B, HHAs are responsible for starting the 4. Option C, HHAs can change the 4 bags. Option D, HHAs adjust the flow rate. The correct answer is option A, home health aides will observe the foresight for problems. The HHA's role is limited to monitoring the site for redness, swelling, or leaking. Question 65. Passive range of motion, PROM, exercises are done. Option A, when a client cannot move on her own. Option B, when a client is fully independent. Option C, only by a physical therapist. Option D, to make the client tired. The correct answer is option A, when a client cannot move on her own. PROM involves the caregiver moving the client's joints through their range of motion. Question 66. When a client can walk, he or she is: Option A, ambulating. Option B, transporting. Option C, transferring. Option D, positioning. The correct answer is option A, ambulating. Ambulation is the medical term for walking. Question 67. When transferring a client from a bed into a wheelchair, where should the wheelchair be placed? Option A, on the stronger side. Option B, on the weaker side. Option C, at the foot of the bed. Option D, in the hallway. The correct answer is option A, on the stronger side. Placing the chair on the stronger side allows the client to use their good leg for support. Question 68. Which of the following is a machine that changes air in a room into air with more oxygen? Option A, oxygen concentrator. Option B, oxygen tank. Option C, ventilator. Option D, humidifier. The correct answer is option A, oxygen concentrator. Concentrators pull in room air and filter out nitrogen to provide concentrated oxygen. Question 69. Which type of urinary catheter remains inside a person for a period of time? Option A, indwelling catheter. Option B, straight catheter. Option C, Texas catheter. Option D, condom catheter. The correct answer is option A, indwelling catheter. Indwelling, Foley, catheters are held in place by a balloon and stay in the bladder. Question 70. Before weighing a client, the scale should be balanced at: Option A, 0. Option B, 5 pounds. Option C, the client's last weight. Option D, 10 pounds. The correct answer is option A, 0. Zeroing the scale ensures an accurate weight measurement. Question 71. Which of the following is an example of a psychosocial need? Option A, the need for acceptance. Option B, the need for water. Option C, the need for sleep. Option D, the need for food. The correct answer is option A, the need for acceptance. Psychosocial needs relate to emotional and social well-being. Question 72. Which of the following is a physical need? Option A, the need for water. Option B, the need for love. Option C, the need for success. Option D, the need for status. The correct answer is option A, the need for water. Physical needs are basic requirements for survival like food, water, and oxygen. Question 73. Families help clients by: Option A, communicating with the care team. Option B, doing the HHA's job for them. Option C, deciding the treatment without the doctor. Option D, paying the HHA directly. The correct answer is option A, communicating with the care team. Families provide critical support and information to the professional care team. Question 74. One function of the respiratory system is to: Option A, bring oxygen into the body. Option B, pump blood to the heart. Option C, digest food. Option D, send nerve impulses. The correct answer is option A, bring oxygen into the body. The respiratory system handles the exchange of gases between the body and the environment. Question 75. Children in their blank years develop language skills and begin to learn right from wrong. Option A, preschool, ages 3 to 5. Option B, infant, 0 to 1. Option C, toddler, 1 to 3. Option D, adolescent, 12 to 18. The correct answer is option A, preschool, ages 3 to 5. The preschool years are a time of significant social and language development. Question 76. The HHA's responsibilities regarding postmortem care include: Option A, placing drainage pads where needed. Option B, performing an autopsy. Option C, calling the family to report death. Option D, removing all medical tubes. The correct answer is option A, placing drainage pads where needed. Postmortem care focuses on preparing the body for the funeral home and managing fluids. Question 77. The eye and ear are part of the: Option A, nervous system. Option B, respiratory system. Option C, circulatory system. Option D, integumentary system. The correct answer is option A, nervous system. Sensory organs are categorized under the nervous system as they process information. Question 78. One way the HHA can respect the rights of clients who are dying is to: Option A, promote privacy for clients. Option B, tell the client to cheer up. Option C, avoid the client's room. Option D, talk loudly to make sure they hear. The correct answer is option A, promote privacy for clients. Dignity and privacy are essential for clients at the end of life. Question 79. Which of the following is a function of the nervous system? Option A. It senses and interprets information from outside the body. Option B. It eliminates waste from the body. Option C. It produces red blood cells. Option D. It protects the body from infection. The correct answer is option A. It senses and interprets information from outside the body. The nervous system acts as the body's control center for processing stimuli. Question 80. Which of the following statements is true of the skin? Option A. It feels heat, cold, pain, touch, and pressure. Option B. It is the smallest organ. Option C. It does not help with temperature control. Option D. It has only one layer. The correct answer is option A. It feels heat, cold, pain, touch, and pressure. The skin is a complex sensory organ that protects the body and regulates temperature. Question 81. The last sense to leave the body is usually the sense of option A. Hearing, option B. Sight, option C. Taste, option D. Smell. The correct answer is option A. Hearing. Hearing is believed to be the final sense to diminish as a person dies. Question 82. Which of the following is a function of the circulatory system? Option A. It supplies food, oxygen, and hormones to cells. Option B. It takes in oxygen from the air. Option C. It produces hormones. Option D. It protects the body from injury. The correct answer is option A. It supplies food, oxygen, and hormones to cells. The circulatory system transports nutrients and oxygen throughout the body via the blood. Question 83. How does the immune system protect the body from disease? Option A. Through nonspecific and specific immunity. Option B. By breathing in oxygen. Option C. By producing bile. Option D. By digesting protein. The correct answer is option A. Through nonspecific and specific immunity. The immune system uses multiple layers of defense to fight off pathogens. Question 84. If an HHA encounters a consenting adult client in a sexual situation, she should: option A. Provide privacy and leave the room. Option B. Call the police. Option C. Scold the client. Option D. Tell the client's family immediately. The correct answer is option A. Provide privacy and leave the room. Adults have a right to privacy and sexual expression, provided it is consensual. Question 85. Respiration consists of option A. Inspiration and expiration. Option B. Digestion and excretion. Option C. Systole and diastole. Option D. Dilation and contraction. The correct answer is option A. Inspiration and expiration. Respiration is the act of breathing in, inspiration, and out, expiration. Question 86. From ages 6 to about 10 years, cognitive development means: option A. Developing thinking and learning skills. Option B. Learning to walk. Option C. Developing secondary sex characteristics. Option D. Losing the ability to speak. The correct answer is option A. Developing thinking and learning skills. Cognitive development in school-age children involves advanced logic and learning. Question 87. In infants, physical development moves from option A. Head down. Option B. Feet up. Option C. Hands in. Option D. Center out. The correct answer is option A. Head down. Cephalocaudal development means growth starts at the head and proceeds downward. Question 88. What does respite care do? Option A. It gives caregivers a break from caring for someone who is dying. Option B. It provides a cure for chronic illness. Option C. It is a form of intensive physical therapy. Option D. It is care given in a hospital only. The correct answer is option A. It gives caregivers a break from caring for someone who is dying. Respite care is temporary care provided to give regular caregivers relief. Question 89. Which of the following stages of child development involves learning to speak and gaining control over bladders? Option A. Toddler, ages 1 to 3. Option B. Infant. Option C. Preschool. Option D. School age. The correct answer is option A. Toddler, ages 1 to 3. Toddlers focus on mobility, language, and toilet training. Question 90. Which of the following is a sign of approaching death? Option A. Decreasing blood pressure. Option B. Increasing appetite. Option C. High fever. Option D. Rapid, clear speech. The correct answer is option A. Decreasing blood pressure. Physical signs of dying include a gradual slowing of body systems. Question 91. When caring for a dying client with diminished senses, a home health aide should: option A. Observe body language. Option B. Speak very softly. Option C. Stop talking to the client. Option D. Keep the room completely dark. The correct answer is option A. Observe body language. Nonverbal cues become vital when communication is difficult. Question 92. Normal changes of aging include: option A. Thinner, drier skin. Option B. Increased appetite. Option C. better hearing. Option D, improved vision. The correct answer is option A, thinner, drier skin. Aging naturally leads to physiological changes like skin thinning and reduced moisture. Question 93. Which of the following is the best way for HHAs to give emotional support to clients who are dying? Option A, by listening more. Option B, by telling the client about their own life. Option C, by avoiding the subject of death. Option D, by giving the client advice. The correct answer is option A, by listening more. Active listening and presence are the most effective forms of emotional support. Question 94. Blank is the special care that focuses on the dignity and comfort of a dying person. Option A, hospice. Option B, hospital. Option C, long-term care. Option D, rehabilitation. The correct answer is option A, hospice. Hospice care is dedicated to end-of-life comfort rather than curative treatment.